Welcome to the Heart of Healthcare podcast.
Hello, listeners, and welcome back to The Heart of Healthcare. I am Steve Krause, and it's been a long while since I've been together with my two soulful besties, Halle and Michael Esquivel.
Guys.
And we got a lot to discuss this month. It's April's Digital Health Download. So much news, guys. Great to be with you, my friends.
Yeah. Happy Q2. We made it. We made it through Q1.
Yeah. Yeah, and the sun is out. First day of March was first day of spring was like a week ago. So I think Halle, you pushed us, and you had a great blog post that we're going to talk about this week that was really optimistic about our sector. And so I think you created a frame for you and challenged me and Michael. You know, a lot of times we talk about some controversy in our sector, but you said, let's keep the stories positive guys, this month. And by the way, if this podcast makes you happy, please, and you love our sector, please subscribe and give us a review. Let us know how we're doing. We'd really, really appreciate it. Thank you so much. So on to the first story, guys. I actually had the pleasure of attending a conference held by Shaper Capital, which was founded by Travis May of Datavant fame in our industry. And it was a conference on health AI, all things health AI. It was last week in San Francisco. Lots of optimism about the role that AI can play in our industry. And they had a lot of different speakers. But the panel I loved about most was a panel that was titled The Role of Government in Fast Tracking AI Adoption for Healthcare Transformation. Quickly, the panelists were, the moderator was David Shulkin, who, by the way, was the former head of VA, and he was a fabulous moderator. It is a really hard job to moderate a panel. I'm sure we've all done it, and he was great for what it's worth. And he moderated a panel with Anish Chopra, who's been on this podcast, Mandy Cohen, who was formerly in the Biden administration, Josh Harder, who actually was a former Bessemer venture partner, colleague of mine, and now is the congressman out of California, and DJ Patel, who's was I think one of the first transformation digital officers of the United States, and now is executive at Devoted. And honestly, they talked a lot about AI, but they really started off talking about the state of government. And I know we've talked in this podcast, and we've sort of probably shown our stripes that it's a little bit of depressing time out there. We've seen news of NIH cuts and cuts to Medicaid, the like and like. But the thing about this panel is there were a lot of there was some doom and gloom. There's worry that we're destroying institutions that are important in health. But I really loved what Anish said, who has been on our podcast and who is an optimist. And he challenged the audience to really think about ways that we could collaborate with the current administration, even if we might not agree with everything they're doing. The fact of the matter is they are appointing some really good heads into CMS. You know, both Dr. Oz, who testified last week and actually had some reasonable things to say, honestly, and some opportunities for the innovation economy, which I want to talk about. But then folks like Chris Klomp, who I know well, who I invested in and was the entrepreneur and leader of Collective Medical, who's supposedly going to be head of Medicare and a senior advisor, and just a great human being and really has his heart in the right place. So it was an interesting panel to really push us. I'm curious, guys, like you probably saw Oz's confirmation hearing, like any reactions to this and any areas that you thought when you listen to those hearings would be opportunities for our listeners to try and make things better in Washington, D.C. and in healthcare? Michael,
you're the lawyer. You go first.
Well, you know, I didn't get a chance to, I saw only recaps, didn't actually get a chance. Unlike listening in to the HHS secretary hearings, I didn't get a chance to really listen carefully to Dr. Oz's confirmation hearing. So not sure I'm gonna be able to add a lot there, but I will say that, Steve, you double clicked on a point that many have been saying, that a lot of the statements he made and a lot of the approaches and perspectives he shared really were surprisingly positive. And I think there were a lot of things he said that people could agree with.
Yeah, let me point a couple. He talked about, obviously we know about the Make America Healthy Again movement, and you could put aside some of Kennedy's views, RFK Jr.'s views on vaccines and other, but you know, there is this, you know, we've all tried to talk about the value of preventative care in our society, and we're going to talk about GLP-1s, but like there's lots of other things you can do. So that's one area where Oz double clicked on. He talked about trying to automate prior authorizations and trying to kind of rid our system of unnecessary upcoding. I thought that was interesting. He really double clicked on, and there was some pushback from some senators, including Democratic senators, about using AI and the power of AI to make frankly, get rid of a lot of the inefficiencies in our system, which I think we all feel. He actually said that he thought CMMI, while very much has been questioned about the usefulness of CMMI, he actually supported it in his confirmation, saying that, you know, he really thinks that that CMI, while it has a history of failed projects, he believes it will do well under his strong leadership going forward. So that's good, because that's been a huge center for innovation. And then finally, he talked about actually private equity, which has not had the most favorable headlines in the Wall Street Journal when it comes to healthcare, being a force of good, because it's one of the ways that, these young innovative companies that we back can actually have a next life. Private equity acquires them and competes then, therefore, with the incumbents who he feels are holding the industry back. So net, well, I think there are some crazy things going on in Washington. There's opportunity there for entrepreneurs.
It's interesting to think about private equity as the other side of the coin for incumbents and these large entrenched players, and to think about that as the antithesis. I hadn't really thought about it that way, but I think we can all agree that partnering with the private sector to drive innovation is something that we all do in our daily jobs, and we're all very passionate about that. So if there are things that we can get behind, it would be that we need public-private sector partnerships, that we need to ensure that innovators have pathways to build new models of delivering care better and more affordably. And then I mean, we just can't argue with really focusing on preventive care. I think this is something we've all been saying for so long. Great. I'm so happy to hear Republicans say this. I'm happy to also see them going and buying Teslas and driving electric cars. These are things that all of us, I had a Prius in 2008. There are things that I don't want to be partisan. And so I'm really happy to meet them where they're at and say, yes, we do need to focus on things like preventive care.
That was exactly meeting them where they're at, Halle, is exactly the point that Anish made, which I thought was really good. We can only hide under the bed covers for so long. We got to get up and actually make some change. And I thought it was it took some guts, because honestly, the rest of the panelists were they're destroying NIH, they're destroying CDC. And it's true. These are hard things it's much easier to destroy than build back. And I don't want to detract from the damage that's going to cause. But we also have to, as innovators and entrepreneurs, we have to find ways to meet them where they're at. I think you said it really well. And I think the second thing I'd say is we know some of these people going into the junior positions that are getting less coverage, like a Chris Klomp, I believe, and people like him, an Abe Sutton who's going to run CMMI, and good to see Dr. Oz back CMMI. These are people who I think are going to be friendly to the entrepreneurship innovation community. And that I think is important if we're going to really make some change in our industry. So, anyways, I try to find some positive. Maybe I should. I'm not putting my Maha MAGA hat on yet, but I don't think that'll ever happen. But I'm trying to find some positive here, guys.
It'll get to your office soon.
No, don't send it. Don't send it. Don't send it. Dude, sender not home. Receiver not home. Anyways, Michael, who's got the next story?
Picking up, maybe I'll pick up on the theme we just chatted about embracing AI. And one of the stories that I picked up was a study that was published in JAMA in February of this year, which was titled "Clinician Experiences with Ambient Scribe Technology to Assist with Documentation Burden and Efficiency." This was a really, really interesting study. No surprise to most of us in the tech ecosystem that live and breathe this space daily. But the study was conducted at the University of Pennsylvania Health System. It was conducted between April and June of last year, and it evaluated the impact of ambient clinical documentation tech on clinical efficiency and satisfaction, clinician efficiency and satisfaction, excuse me. It specifically examined Nuance's DAX Copilot product, which is an AI-powered ambient scribe integrated with the Epic EHR system. And the clinicians used the tool via the Epic Haiku mobile application to automatically generate clinical notes from their patient encounters. And the study specifically assessed how this technology affected documentation time, workflow efficiency, and provider experience within a real-world healthcare setting. And it was interesting. So not surprising, again, to the three of us, but the findings showed that there was a reduction in documentation time. Clinicians spent 43% less time on documentation outside of scheduled patient hours. Super compelling. 2, they found that there was improved workflow efficiency. The use of Epic integrated ambient AI allowed these providers to generate accurate, structured clinical notes with minimal manual input. I mean, just dramatic impact for these providers. And then third, they enhanced the overall provider experience. They got these providers, the participants that engaged in the study, reported higher satisfaction with their documentation process, citing reduced administrative burden and improved focus on patient care. And then the final finding was there were sustained benefits. This positive impact on workflow and time savings, it persisted throughout the study period, which really indicates there is long-term value for the clinical practice of deploying these technologies. So I know, Steve, you invested in some of the big players in this space. Maybe I'll start with you. What do you think?
Well, Michael, I love this story. No surprise. We are one of the early investors in Bridge, and it's been a remarkable company to be part of. The founder there, Shiv Rao, is just like, we talk about wanting to back bilingual founders who both understand technology, understand healthcare. He's a cardiologist, still practices himself. He's just fabulous person. But the company has been such a great example, and I believe this is true about the potential, Michael, that you highlight of AI in our space broadly. It's been a rocket ship, and I always say, like, I work at Bessemer, which is a multi-stage, multi-sector platform and venture platform. And I've always felt like, as a healthcare person, a little shy to bring my companies forward because they've always been like 10 or 15 years behind in terms of our industry's technology adoption. Like EMRs, those are systems of record. Like that was what Oracle and SAP and Salesforce did 10 or 15, 20 years before healthcare. Virtual care, while it was really important, and we've talked a lot about it, like DoorDash and Uber were a decade before, in other industries. And we're just doing it in healthcare, and it's not even that great of an experience. Actually, with the AI technologies and, scribing an example, healthcare's finally at par in terms of adoption of these technologies. And one of the reasons, Michael, that these companies have seen such great results, which Abridge indeed has seen, the very similar results that you talked about in its customer base, is because the product is magical. Like, it really is magical for end users. And when have we ever said that in healthcare? Like, never. EMRs, people hate them that use them. Virtual care,
yeah,
it's kind of shoddy, right? Like, it's it's getting better. It's getting better, but it's not the best. This is the first time that a product's been released into the wild in healthcare where it literally is like, oh my God, I can't wait to use Abridge. Like, one of the quotes that we've heard, and the main reason that Abridge has been so successful is that literally Dr. Love, like Dr. Love, like one doctor said, if you ever take this away from me, I'm leaving my practice. Seriously, like,
that needs to go on Abridge's
take Abridge away
homepage.
from me. I dare you. Right. But the reason that's important to me is, obviously it's important because doctors are critical to the delivery of care and to the quality of care. And there's been a huge burnout out of COVID for doctors. But secondly, like, the thing that's been so hard in getting healthcare adopted has been actually the user experience. And, actually users learning how to use the product, engaging the product consistently. And with these new AI technologies, it brings down the hurdle of adoption, right? Because in some ways they're either co-pilots or they're agentic, and it just happens. And so one of the biggest barriers to adoption of software in healthcare has all of a sudden gone away overnight. And that is so awesome. Like, that's why these companies are getting traction. Yeah. So it's exciting.
Like, I don't want the doctors treating me to be wasting time on documentation. I don't want them burning out because they have to work all night to take notes from the day. I think that it makes a lot of sense. And now every time I've had a doctor's appointment over the last 6 months, it's the doctor's always like, I'm just going to record this. Is that okay? And I'm always like, which app are you using? It's okay. I work in the industry, and I talk to them about it. But I shared this study with a friend of mine who's a doctor, and she uses Nuance to transcribe patient encounters. And she said just between the last version and this version, like, the amount of improvement was really incredible.
Well, but you said something that's really important, Halle, and I do want to give out a shout out to Ambient. I have the privilege of working with that amazing team. One of the when you talk about the improvements, one of the things that's clear to me is scribing is not enough. You've got to integrate it with billing and coding. You've really got to take that next step. And I think where some of these early iterations is really just on the scribing piece, but it's not, doctors, you're having doctors figure out what billing code to apply, how to do it. And that's where these technologies are going to go in the future, because then it really lessens the burden. For now, this is 1.0, but we need to be getgetting to really improve sustained experiences for our clinicians.
Well, when you say in the future, it's like, that'll be in 6 months, right?
No, that's tomorrow.
It's already here.
That's the cool thing about this. And to be a healthcare founder, traditionally, you did not have to be bilingual, as you called it. I love that term, Steve. I don't think traditionally that's been something that founders who have succeeded needed to bring to the table. But now with AI, you have to be very fluent in the tech side of things. And so the sort of founders that are in this space now are innovating at a pace. Their technology is advancing at a pace that we've never seen before as well. So it's all super cool.
And two other things. Like, think about it, Halle. Your point. You used to go to your doctor, and your doctor had your back to you a lot of the time because they were entering. Now the doctor can engage on you, can engage you, feel, and doctors want to do that. That's why they get into the care. They want to heal people and treat people, right? That's number one. And then two, as part of that, like that doctor to patient conversation, a lot of that nuance and data has been not captured in our system before. And so the power, everyone's going to do RCM. That's the next step, Michael, I believe. And that's going to be huge. I agree with you. But like, there's a lot of data that was uncaptured before in that conversation between, but the opportunity set of what you're going to do with that is going to be, people don't even quite appreciate yet, I think, the opportunity of what to do with that data. So it's going to be exciting space for sure.
And I think a final thought on this, I think also that you need to really set these technologies by specialty area. This one size fits all, like there really is nuance, pardon the pun, with different specialty areas. So there's lots of exciting developments, and you're right, Halle. This is happening in days and weeks, not even months anymore. So it's going to be amazing to have this conversation this time next year.
Honestly, I'm shocked now when I talk to clinicians and health systems who don't have this. That's where it's become like one of my poor friends had to meet with like 35 patients. She's an ENT doc in one day, and she was lamenting she was late to dinner, which I get because she had to see so many patients, and then she had to lament the next day. She had to spend the entire day basically capturing, scribing for herself.
Hook her up.
I was like, Stephanie, how do you not have a bridge?
Okay, so my story is about the Rock Health Consumer Report, which was just released. So we started these consumer reports over a decade ago at Rock Health. And we, it was Malay's idea, but we just decided we wanted to survey thousands of people, census matched, representative of Americans on their adoptions and views towards digital health. So it's just been really cool. Now we have this longitudinal data. We can see how things have changed year over year. And boy, have they changed. Like, it is so cool to see people leaning in. And this report really focused on two things. One is kind of just wearable devices and tracking, and then kind of trust. And those were kind of the two big findings within this report. But we learned that over half of Americans now own a wearable device, including over a third of boomers, which I'm just shocked. Over half track at least one health metric digitally. 58% of Americans use virtual care in the past year. And that's actually down from 2023, but still like the majority of Americans. You can think how many people just didn't receive care at all. I would guess 20% of Americans just avoided care altogether. So that was pretty interesting. But this year they chopped up the data generationally. So I'm an elder millennial, and my group has the highest wearable ownership. Here I am. I have 3 wearables just on this arm. I have my Oura Ring, my iWatch, and now I'm wearing the Dexcom Stello, which is the glucose continuous.
Wow, good for you. Halle, if you're an elder millennial, I do not want to ask.
I'm going to tell you guys.
I know, Steve, we're just
you are about
to get thrown under the bus.
My younger cohort, 66% of us have own wearables, and we're the most willing to trust tech companies with our health data. So you guys are both Gen X, you know that. they
hitting us where it hurts, Halle. Hitting us where it hurts.
Virtual pragmatists.
So unfair.
And you guys use virtual care below average, and usually you do so because you want shorter wait times. You use it as like a convenience thing. You're also less likely to track health metrics digitally, but still 23% of you track physical activity, and 18% of you track blood pressure. So I wanted to know if this data about your generation checks out.
Well, Steve, I'll let you go first as the elder statesman.
He did just have a hip replacement, so that.
Oh my God! Oh my God, you guys are aging me. I found this really interesting. I won't comment on my generation. I agree. Like all the data was fascinating. The thing that I wanted to comment on, Halle, was actually I was like underwhelmed by, and I think this is like a broader political thing too, which is a demographic thing, the lack of trust that the younger generations have. Gen Z, only 42% of Gen Z were willing to share data with a provider, meaning like a clinician, right? And only 46% completely trust health info shared by a provider, right? Like, so they're like very skeptical generation versus like the silent generation, which is, the eldest generation. 90% were willing to share data with a provider, and 76% completely trusted health info shared by a provider. Like, this breakdown in trust in our society, which we see throughout, like, frankly, in politics and in the world, is really concerning. But it's really concerning when it comes to health data. Like, that to me was the most striking thing, right? Is like, what do we do with that data? Great to see people using wearables more, but the whole point of using wearables is to track data at real time and to share that data and integrate that data with other sets of data to know how you can improve your health, right? So,
and what do they even mean, like completely
it's really funny to me that
trusting health info shared by provider? Like, providers don't share much health info other than like test results, diagnoses, like suggestions for treatments. Like, it's fascinating that under half of Gen Z would not trust that info.
I think there's so much disinformation in the world right now, in where it comes at you from every single platform, every single second of every single day, that that everybody is skeptical of everything. That's my view, which is weird, because these are also the people who are pushing forward functional medicine and are drinking less and are doing things and that are helpful to them, right? That are, actually questioning some of the priors that we all had about how we manage our health, right? They're probably more conscious about food intake. And yet at the same time, they're like questioning authority when it comes to, like, clinicians don't get in. The majority of clinicians, like 99.9999%, don't get into healthcare to mislead you about your data, right? Like, that's not what they do. So this is a weird dichotomy I have. Like, I just couldn't get my head around it. All right, guys. Well, I've got my second story, and we were talking about the rise of wearables. It sort of the rise of wearables follows the rise of Halle Tecco. And my next story is a story that features Halle Tecco. She did a wonderful piece on her blog post and her blog about where she analyzed what happened to the digital health unicorns that grew
minted,
up or
that were
became
minted
unicorns between. Were minted, thank you, Halle. Were minted in the ZERP era, between 2020 and 2022. And I thought this was an awesome piece because, a lot of the coverage in, the tech and healthcare press, and even on our podcast, so we're keeping it positive this week, is about the failures, right? It's about the olives and the forwards and the layoffs at Dispatch Health and Commure and IntelliCare and CityBlock, and the list goes on and on and on, right? But Halle's piece Halle, I'm hopefully making you blush, was really good. She looked at the past 65 digital health companies that were minted, had $1 billion plus valuations in that ZERP era, and wanted to see what happened to them. Just was like very, intellectually honest, data driven. Like, where do these companies stand? And what she found was really interesting. 89% are still operating today. A third of those active have actually managed to be able to raise additional funding in the period beyond the ZERP era. So in 2023, 2025, despite a very tough market, as we all know. We've got one went public, one's preparing to go public soon. There's a bunch that are probably most likely going to follow. 4 companies were acquired and 2 actually meaningful acquisitions, and 2 of the companies have shut down. So, like, I think, our industry has faced some tough times. Public markets haven't been favorable to, comps are low. But I think everyone's like, woe is me in digital health and everything stinks. And Halle's piece was like, well, I think don't bury us yet. Like, I think the chapter's yet to be written on what happens. There's lots of companies that are thriving and staying alive and frankly have taken some action to improve the underlying unit economics and P&Ls, and maybe we'll make it through, and we'll see. And so I thought that was like super cool work. Thank you, Halle. As someone who tries to champion the industry, I know you do too. Curious, like, I have so many thoughts. I have a couple thoughts beyond what I just said, but want to turn it over to the author of this, post and to you, Michael. Like, Halle, like what stuck out to you in addition to what I noted?
It was really interesting to me because I do feel like there's a story of doom and gloom around the ZERP cohort. And so I wanted to just look at this cohort honestly and just see where they are. I've invested I have a couple of companies in this cohort. And so I've known the inside of what's going on there. I think like 4 or 5 of them. So I kind of know their stories. But overall, like, I think everybody has a similar story, especially those that raised towards the end of that ZERP era. They almost got lucky in timing in that they had a lot of cash and then they quickly learned that they had to spend that cash in a completely different market. And so they were able to kind of right size, re-strategize, and really extend their runway to figure out a new business model that would make sense for the new era that they were in. You can't blame founders for raising as much as they could during that era.
No. Why wouldn't you? Why would you not?
They were smart.
They were smarter than one founder called it was a hibernation strategy, was like, we're going to cut costs, we're going to focus on growth, we're going to get to profitability. We don't want to have to raise, for many years. And so I think a lot of them did that. And I think there are a lot of really, really good companies. I think a lot of them will raise again or exit or have an IPO at perhaps a valuation lower than the valuation there. But I think that's really market driven and not because they aren't fantastic companies that are making a difference in healthcare.
What is amazing to me, Halle, in your report or your post is it really showed that these companies, the really good ones that have great execution teams, really were able to pivot quickly from a growth at all costs mentality to a really disciplined, we got to grow rationally and in a profit-focused manner.
Real whiplash for those founders.
And I've seen it. Look, yeah. It really was, but it was a testament to their fortitude, their conviction in their ideas. You're right, the fact that they'd raised enough capital to give them time to emerge out of this hibernation state, if you will. It's really exciting to see. There's a lot of really, really promising companies, and I agree with you. Look, they're not all going to exceed the valuations from that era, but I think a lot of them are building really meaningful businesses that are going to have lasting impact. And I'm pretty fired up about where our industry is
as Michael,
headed.
You always say to me and all the other founders that you work with is like, it's okay if valuations go up and down. It's really about having clean term sheets, a clean cap table, and not overcomplicating it. Like, it's okay.
So Halle, I know we want to move on to the next story, but just to ask you, when having done this work, and when do you think the chapter will be written for this cohort? Is it 2032?
Oh, yeah.
Is it 10 years?
Yeah,
like what? Because I think people are like,
I'd give it a decade. I mean, I did another study that looked at all the exits, either over 100 million or that went public that are valued at over $1 billion. And for those, the average time was 9 years. Let's look back and see what it is.
2032. Hopefully, the harder healthcare is still booming by then.
We'll still be around.
We'll look back.
It'll be even more ubiquitous.
I'll be a member of the silent generation by that point. But
I don't think that's how
my
it
data
works.
will be freely flowing to my provider. It'll be totally trustworthy. Hopefully, you guys take care of me.
All right. I'm going to pick up on the positivity theme for today. And seldom does a session of ours not eventually end up talking about
every
GLP-1.
time, every month.
So I picked up another great story in JAMA, another study that was titled Lifetime Health Effects and Cost Effectiveness of Tirzepatide and Semaglutide in U.S. Adults. And really fascinating story. Not going to be a surprise to either of you, of course, but obesity is a major public health issue in the U.S., as we all know, increasing the risk of diabetes and cardiovascular disease. So the study was focused on new anti-obesity medications like Tirzepatide and Semaglutide and analyzing, are they offering significant weight loss and cardiometabolic benefits? And then looking at those benefits and comparing them against costs and raising concerns legitimately around affordability and insurance coverage. So the study was conducted in 2024, and it did, in fact, evaluate the lifetime health effects and cost effectiveness of 4 FDA-approved anti-obesity meds: Tirzepatide, Semaglutide, phentermine, topiramate, and naltrexone. And it compared these with lifestyle modification alone. And it's really fascinating because the study was modeled off of data from a 2017 to 2020 survey that was done by the National Health and Nutrition Examination Survey, and it looked at 126 million eligible U.S. adults aged 20 to 79 years of age. And it looked at long-term health outcomes around obesity reduction, prevention of diabetes and cardiovascular disease, QALYs, which for the uninitiated is quality adjusted life years, and healthcare costs. And really fascinating because it demonstrated that Tirzepatide and Semaglutide, i.e. Mounjaro and Ozempic in today's lingo and the brand names, had the greatest health benefits, significantly reducing obesity, diabetes, and cardiovascular disease cases. I mean, it was really, really striking, you guys. But the challenge was neither of those two were cost-effective at current prices. And here's the real killer. So in health economics, and Halle, you know this well, we analyzed the cost-effective ratios at $100,000 per quality, again, per quality adjusted life years. And in order for us to reach that threshold, which is the holy grail here of effective cost effectiveness, Tirzepatide would have to drop by 30.5%, and Semaglutide would have to drop by almost 82% in order for us to hit that threshold. And so the policy implications were pretty clear. The study underscores the need for, not surprising, price reductions and ensuring that we have equitable access to these highly effective anti-obesity medications. So, it clearly shows what we've been talking about for the last, I don't know how many years, but it does validate. It validates that the cost economics, the health economics here just aren't there.
GLP-1s are effective. They're not yet cost effective, but they will be. So one of the arguments that has been most influential to me was in The Great American Drug Deal by biotech investor Peter Kolchinsky. And he argues, and I now kind of have taken on this argument, it is frustrating that branded drugs are expensive, but they could be viewed as a societal investment, because actually drugs are the only thing in healthcare that ever gets cheaper, because brand name drugs eventually go generic and they become dramatically cheaper while maintaining the same benefits. But in contrast, like every other part of healthcare, services, colonoscopies, hip replacements, they only move in one direction, up,
always
up,
increasing.
So, we have a major cost issue that has impacted access, and it will be nice when it goes. It already has gone down. You already now can get Novo Direct is offering it for Wegovy for $400 if you buy through them, $400 a month. Now that is still wildly expensive, but the price isn't going to go up. It's only going to go down from here. And this is the only place within healthcare where the prices actually do go down.
Halle, I think it's actually really interesting. We've talked about this, that I actually think pharma for the first time is waking up to their pricing model and questioning it, because generally, what's revenue? Revenue is price times quantity, right? And generally, pharma's been focused on maximizing price until until their patent goes away, right? And that means they have high price but limited queue. They'll make up for it with the high price. But here, they've realized for the first time ever, you mentioned it, NovoCare, Lilly Direct, they're actually willingly and openly dropping their price because they've realized that the queue is so massive that they actually can get to the same average revenue per user or average revenue for their company by just having lower prices. So you see this actually happening. Now, granted, it's only in cash pay. It's not, they're trying to maintain the reimbursement rate for commercial insurance and Medicare, but still, like, that's really interesting. We haven't seen that before. So I think if, and frankly, the P for one of them is actually like at 30% of what the net price is. So actually, for the direct pay patients, the quality adjustment benchmark of 100,000 might actually be met. So very interesting market dynamics going on in this space.
It's $100,000 a year is what we've decided is the value of someone's like healthy life. Like, who picked that? I don't know. I need to look into that, where that came from.
All right. Well, that was a wide-ranging conversation. Very optimistic. Thank you, Halle, for the push. Happy April to all our listeners. Again, if you enjoyed today's podcast, we'd encourage you to subscribe and please write us a review. We want to hear from you. We'll see you next month.
Good to see you guys.
See you soon.